It was the selfless wishes of 17-year-old Abby Basson in May 2009, who is terminally ill from a rare form of cancer, sarcoma, that's led us here today to a week dedicated to raising awareness of sarcoma. Sadly, Abby Basson passed away 3 years ago. Never got to see her dream realised. But Mandy Basson is in the studio. She's Abby Basson's mother. She joins me along with Simon Carroll, who, of course, is a regular on the programme, talking about some of the science breakthroughs. Simon from SciTech, good morning to you both. Mandy, let's talk about this. As I said in the sort of the tee-up to this, we'll talk about the likes of breast cancer, prostate cancer, and many others. But we hear very little about sarcoma. I mean, if ever there's a need for an awareness week, this is it, isn't it?
Well, I believe so. I think the thing about sarcoma is that it is such a rare cancer. But what's quite frightening about it is that although it hits the whole demographic, it has got some of the subtypes of sarcoma. There are over 70 of those, tend to hit paediatric and the 15 to 25 age group in particular. So
that's interesting. So you got paediatric and then you got this 15 to 25.
That's right. It's separated like that largely because the needs of 15 to 25 age group are so different. They're a very unique group. And so looking at the way we treat them and the needs of that group do need to be identified quite specifically and addressed differently. So we do separate them off for the different needs.
Okay, let's talk about what it is, because again, it's a word we may have heard in passing, but we know very little about. So, what is it?
Sarcoma is a group of tumours that are primary bone or affect the connective tissues, and so that's muscles, nerves, tendons, joints, those sort of connective tissues in the body. Right,
and what plays out? What happens?
There's the symptoms that you get, they're very easily missed because they're quite vague. So, for example, you may get a lump that is painless or painful. It gradually grows and changes. You may not notice it particularly. You may get a pain in your back, you may get a pain in a leg or an arm, and you think it's a sporting injury, so you ignore it. And it goes on and it goes on. And then by the time it becomes so painful or so obvious, you go to your GP then, and then you find that the cancer has already been in your body for some considerable time and it has spread and metastasized.
Right. So how does this differ from bone cancer?
That is. Bone cancer is... sarcoma is primary bone cancer. So we often hear of bone cancers being a secondary from another form of cancer. So you can have breast cancer or prostate cancer, which when it spreads, it goes into the bone. But with sarcoma, it is primary bone. So the original tumour arises in the bone.
Right, okay. Now, obviously, getting in there early is key, hence why we're talking about it now on the Awareness Week. If you get it in early, if you're treated early, are your chances good?
Much better than if it metastasizes. So, for example, in Abby's case, her symptoms first were noticed about 4 weeks before her diagnosis came out. By the time her diagnosis was made, it had already metastasized from the original point of the pelvis into her spine, into her ribs, into her lungs, and into her lymph nodes. That's 4 weeks after she noticed the first symptoms.
Wow. I mean, the rapid.
Very much so. And that's why we're really keen to get the awareness of what sarcoma is about, because the sooner you get to your GP, the sooner you are recognised as having a sarcoma, then your chances are much greater for the actual treatment of the disease.
Right. Okay, this is fascinating. I'm talking with Mandy Basson about WA Sarcoma Awareness Week. Also in the studio, Simon Carroll, who is a survivor, which is lovely because, well, obviously you can bring a totally different perspective here, Simon. But tell us about what you were going through, what you felt when you were diagnosed.
Yeah, thanks, James. And, have to congratulate Mandy on all of the effort that she's put in and achieved, she and her husband Steve, in the sarcoma program, Socket to Sarcoma. But I got involved with the program after my experience. I was probably one of those people who ignored the symptoms, or the sign in my case, which was a lump on my shin. I'd been doing a lot of sailing and I thought I just bumped it and it was a little egg and it didn't go away.
Yeah.
And like many men, I waited.
It'll go away.
It'll go away, or I'll wait for a number of other ailments before I'll go to the doctor.
Do three at once.
Absolutely. Eventually, I started noticing that my leg was swelling at the ankle because of the compromised circulatory system of the pressure from this small lump on the front of my shin. And ultimately, I had a number of diagnostic tests done. They came back negative to start off with. They thought it was a hematoma, which is a bump, and it didn't go away, and we thought it was just fibrosed. So then a month later, when that hadn't gone away, I had another look at it, and then they had a needle biopsy, and the word came back that I had quite an aggressive type of sarcoma in the front of my leg. So I very quickly was set up and had the options. If it had spread to the bone, I was signed up for an amputation because the classification of the aggressiveness of the tumour was such that if it had got into the periosteum, the surface of the bone, then it's likely to have spread quickly. And so I was signed up for an amputation, fortunately, with limb salvage surgery, which is where they try to save as much of the limb as possible.
Yeah.
David Wood here in Perth, Professor David Wood at the Rehabilitation Centre at Hollywood Hospital, did the surgery, and then I got a fabulous plastic surgeon to come in, and they took a piece of muscle out of another leg and filled the hole, because the limb salvage surgery is getting clear margins around the tumours. So this is about 2.5 to 3 centimetres. So if you've got something on the front of your shin and you dig it out, you know that you take a fair amount of the bone. So after that, when you do the look at the studies, and as Mandy said, if you get it early and you take treatment, in my case, it was recommended that I also have some chemotherapy. So 6 months of chemotherapy, I've managed to get back. I no longer run, but as you know, I cycle.
Yeah, it's amazing. And Mandy, this is obviously you'll hear many stories like this. Amputation, how often does that have to happen?
It can happen quite often, but the aim is now to try and prevent that as much as possible by using the limb salvage surgery, and the techniques in that are advancing all the time.
So we're talking about raising awareness, but I suppose also by raising awareness there is going to be probably more research done, and that will help as well, won't it?
Absolutely. One of the things that Socket Sarcoma is trying to do is to promote research, because obviously the more you learn about sarcoma, then the better the treatments can be. And the causes of sarcoma are not actually known. There are a few indications. There are some of the subtypes that have some ideas of where the malformation happens. It is in many cases a genetic malformation which then becomes triggered and then creates the malignant cells. And one of the reasons for Socket sarcoma is that Ewing's sarcoma has a known translocation of genes 11 and 22, which is one of the triggers. When that gets triggered, that malformation, then the cells mutate and become malignant. And that mix match of the 11 and 22 cells gave Abby the idea for the odd socks identifier that we use for Socket sarcoma.
Oh, it's all coming together now, isn't it? Okay, right, fantastic.
And it also is linked with that amputation theory, that if you have an amputation, then you may only need one sock. And so that was her idea of odd socks becoming our identifier, which is what we use for fundraising.
Very clever. In terms of recovery, if you are caught early and the surgery takes place and doctors do a good job, is that it? Is there a good chance that you'll just fully recover?
You'll certainly recover. I mean, there are some potential long-term effects which you have with any kind of cancer treatment. Yeah. So once you've had your treatment, and with sarcoma you could have all or some of a combination of radiotherapy, surgery and chemotherapy. Yeah. There are possibilities that later on you are susceptible to a further recurrence of a cancer. Sometimes blood cancers can be a result of the treatment that you have for sarcoma. But many people go on to have really successful, long lives, and that's what we're aiming for, of course.
Good. Now, this is the first time you've done the Awareness Week, isn't it?
It is.
Okay. So we're doing well. We're off to a flying start because it doesn't even start till Monday.
That's right, and we're really excited and really grateful for the opportunity to promote it. Thank you very much for letting us do
That's
this.
okay. I mean, all these sort of things, the more that people talk about it, the more they recognise. If you want to go to the website, you can sock it to sarcoma.org.au. Is it sarcoma.org.au or sock it?
Sock it to sarcoma, all one word, yeah, all one word.
Sock it to sarcoma. And sarcoma, if you're interested, is sarcoma, sarcoma.org.au. Simon?
Yeah, I was going to say this week there's a range of activities that are going to go on, culminating in a public seminar day at the Harry Perkins Medical Research Institute, which where the public can come along and listen to experts, ask questions and learn more about the treatment and the disease. We've got a range of programs in research that are going on at the Harry Perkins Institute, and we're very grateful for the Hollywood Private Hospital Research Foundation, which looks after all of the activities from the financial side of it as well. So we've got a PhD student already working on the genetics of sarcoma.
Good.
And many other things in the pipeline.
Yeah, well, it is amazing that we know, so little in comparison to so many of the other the cancers that are discussed readily. So go and have a look, socket to sarcoma.org.au. Mandy, thanks for coming in.
It's my pleasure. Thank you very much
and
for the time.
congratulations for getting this going. And Simon, thanks very much. Thanks for being a survivor.
Yeah.
Good on you.
Thanks, James. Thanks,
26 minutes past 7 here on Saturday Breakfast.